Hello everyone, and welcome back to my channel. My name is Dr. Stephen Roth, and I'm a board-certified oral and maxillofacial pathologist. I am so excited to roll out my new clinical review series. I have two main goals for this series. The first is patient education. So often I will find that when I counsel a patient on a diagnosis that I've rendered, that I overwhelm them with information. I'm sure that only a percentage of what I say is remembered, and then Google fills in the blanks, which opens the doors to misinformation. I don't blame my patients for this. Oftentimes these diagnoses are completely new concepts and there's a lot to remember. I hope that by creating diagnosis-specific videos, patients will have a reliable, evidence-based information source so that they don't feel the pressure to remember everything during an appointment. These videos are not meant to be comprehensive reviews of all presentations and epidemiologic and histologic findings, but rather focus on the clinical implications of these conditions. My second goal is to disseminate knowledge to providers about how one oral pathologist, me, handles certain common entities. There are very few clinical oral pathologists in the United States, and it can be very difficult for a patient to find a specialist in their area. My hope is that providing this information for oral and systemic healthcare providers will be helpful in managing patients. One major disclaimer, which I make in every video and will be especially important in this new series, is that my videos are meant for education, not for diagnosis or self-treatment. If you are a viewer that is concerned about whether you may have one of these diagnoses, you must talk about your concerns with an oral or systemic healthcare provider. These diagnoses should only be made after a complete gathering of history as well as a comprehensive exam. If you're a provider and you're still uncomfortable with these conditions in both treatment, diagnosis, and management, then you should still refer out to your proper referral channels. In addition, these videos will only discuss my personal approach to these entities. There are a lot of right ways to approach and treat these conditions. My way isn't the only right way and isn't intended to be. The opinions are mine and mine alone and do not represent any organization I'm a part of or any employer that employs me. These approaches are based on evidence and experience, and again, will hopefully serve as a reminder for my patients after our initial discussion. Thank you for all of your support. I hope that you find this new series both informative and helpful. Be sure to subscribe if you haven't already so that you don't miss any videos in this series or any of my other oral pathology videos. Thanks again for watching, and be well.